Hey everybody, Dr. Dusty here, and I want to go over a couple things with you in regards to your stomach and digestion. Okay, so here we go. So first off, your stomach sits here, kind of over the left side and center left, and just below the rib cage sits your stomach. Leading into the stomach is the esophagus, and leading out to the stomach, and the next part of digestion is your small intestines. All right, so let's go over some data on the stomach. So first off, your stomach acid is very acidic, and this is a pH scale, kind of a chemistry thing here. At 0, it's very acidic, and at 14, it's very basic. All right, so the stomach acid sits at about 2.0 on the acid base scale. So it's about right there. Now, about right there is battery acid, which is 1.0 on the scale. Very acidic, burns your hand if you get any battery acid on your skin. Then setting at 3.0 is vinegar. So vinegar is pretty acidic also. But stomach acid, again, is at 2.0 on the scale. Again, very acidic. The second point here is that the stomach is a mixer, a grinder, and a digester of foods. So when food enters through your mouth, down your esophagus, into your stomach, the stomach starts to work on it by dumping some acid into the stomach, and also by churning and mixing and grinding the food. So it's actually not only a chemical reaction that occurs in your stomach, but also there's some mechanical action of grinding and mixing. Okay. Now, point number 3, your stomach is part of your immune system. So the acidity that is present in your stomach actually will kill viruses. It will kill bacteria. It will kill parasites. So things that you ingest or you come in contact with that goes into your mouth will then be handled by the stomach acid. All right. Point number 4, the stomach holds about 1 quart. That's quite a bit. So fluids and solids, about 1 quart. Number 5, the nerve supply. The stomach gets the nerve supply from your upper neck, which is the vagus nerve. That's a cranial nerve. And vagus basically means wandering. So the vagus nerve wanders around your body and goes to different organs of the body, like your heart, your lungs, stomach, small intestine, liver, gallbladder, large intestine, and so on and so forth. And then the second area of nerve supply is the nerve branches from your mid-back, like between your shoulder blades. Okay? Now, point number 6, you influence monitor, and affect your stomach and your digestion by eating good foods or by eating bad foods. And that's basically kind of your choice on what you actually put in your stomach. Fast foods are not good things to put in your stomach. Just a side note. All right. Point number 7, antacids and proton pump inhibitors ruin your stomach acid. It just handles and decreases or affects your stomach acid, and it actually ruins it, opening up your body for more problems with immune system function. And it also affects the ability to digest and absorb foods, especially your minerals. It's very much affected by taking antacids and PPIs. Okay, point number 8, chiropractic adjustments and pressure point therapy can help immensely with stomach problems. So when people have acid reflux, when they have bloating, when they have belching, chiropractic adjustments and pressure point therapy can help restore normal nerve supply by adjusting the neck and the upper neck and the mid-back vertebrae, you can affect and improve digestion of the stomach. So what we're going to do now, I'm going to demonstrate to you what I do here in the office in treating stomach problems through chiropractic adjustments and pressure point therapy. Okay, so I just went over some data with you in regards to your stomach. Now I'm going to show you some of the things that we do to help people with stomach problems, and I have Cameron here to demonstrate what we do. First off, I'm going to show you some pressure points that I do here in the office, and I'm going to utilize this pressure point therapy jackknobber, and I'm going to do these pressure points. Now we're going to do, of course, the mid-back here. This is the nerve supply into the stomach, and then the nerve supply in the upper cervical spine or upper neck. So here we go with those pressure points here in the mid-back, holding for about 10 or 15 seconds. Okay, I know I'm not holding it for 10 or 15 seconds, but I'm demonstrating how this procedure is done here in the office, basically. How's that pressure there, Cameron? You okay?
Yeah, that's good.
Okay. So doing about 5 or 6 pairs of pressure points in the mid-back. And sometimes if they're really tender, especially in this area, or really tight, you can repeat those pressure points. Okay, now upper cervical spine, where the base of the occiput, you know, the kind of the back of the head and the neck meet, those can be some pretty tender pressure points on people. How's that pressure there? Is that okay?
Yeah.
Kind of tender?
Yeah.
All right. Okay, so I like to do a lot of those pressure points in the upper neck because it tends to release a lot of tension in a person's body by doing those pressure points. And then it also makes the adjustment easier to do. All right, so now doing these chiropractic adjustments, I'm doing this for demonstration purposes. This is not something that you should do at home. And being a chiropractor, we've learned how to adjust the spine, the amount of pressure to use and force, and the exact angles of correction that need to be done. So it's not advisable to be doing any of this at home, okay? So here we go. Cameron, take a deep breath in and blow it out. All right, so here we go. Good. All right, deep breath in and blow out. Okay, and one more time. I'm going to get that spot right there and blow it out. There you go. Good. Okay, very good. All right, now I want you to lay on your back. Okay, so there's a set of pressure points that I also do for the stomach area, especially if people have acid reflux. And so I can go right below the sternum and put some pressure on that, so kind of in a downward pressure, and that will actually pull the stomach out. And Cameron's trying to laugh here. Must be this is an active pressure point there in the stomach, huh? Is that a little sore?
Ticklish.
Or more ticklish, all right. When people have ticklish spots when you're doing these pressure points, that's an indicator that that's an active pressure point. So you can do that. It helps with acid reflux and GERD and all that stuff, bloating. All right, so that's the set of pressure points that we do for the stomach and the front. Okay, now let's do a set of pressure points again, kind of in the neck. I'll take my finger and kind of work that back of the upper cervical spine. Okay, so again, I'm going to make an adjustment here, and so it's like that. Again, this is something that you should not attempt at home. All right, and here we go. Okay, so does that feel pretty good there?
Mm-hmm.
So that was the upper cervical spine. So that is the pressure points and the adjustments that we do to help people with stomach problems. So if you have any questions or would like an evaluation regarding your body, and if you have digestive problems, give us a call. Our contact information is below. Look forward to seeing you in the office and helping you live a healthier life. Bye-bye.